good afternoon, everybody. I'm highly thankful to Ahmedabad Orthopedic Society to allow me to take a talk on a topic in which still I am also learning, revision knee replacements. Basically, introduction. The burden of revision knee replacements has been now gradually increasing, particularly as sir says, because of aseptic loosening, because of infections, because of instability. And with the increasing number of surgery in the PMJs, this burden of revision is now going to increase substantially. So there are some very basic principles which we follow. First, restore the alignment. 2, a very stable fixation. 3, manage the bone loss very nicely. 4, balance the soft tissues very nicely. As sir already described, just in brief, the AORI classification is the classification for the bone loss which is widely followed to manage the defects. Type 1, Type 2, A, B and Types 3. In Type 1, the metaphyses are intact. Type 2 is an uncontained defect in which if only one condyle is involved, it's 2A. If two condyles are involved, it's 2B. And significant deficient metaphysis is Type 3. Important here to know is this classification is based on intraoperative findings. That is after the removal of implant. So you cannot decide prior, okay, this is type 1, type 2 or type 3. After you remove the implants, then you can make out which type of classification you are dealing with. So in brief, in type 1 AORI, we generally manage the defects with PS implants, wedges and augments. In type 2A, generally it is managed on the femoral side using augments and rods, and on the tibial side generally with sleeves and cones. Now again, I would here like to explain a small difference between the sleeve and the cones, which many of the times we get confused. Sleeves, basically they are integral part of the prosthesis that matches the implant typically, and fixation, it directly fits with the implant and offers the cementless revision, gives a rotational stability. Cones, basically they are independent porous metal components which are placed into the bone defects. So like then prosthesis is fitted into the cones. Type AORI type 3, now here the decision will depend whether the collaterals are intact or not. If the collateral ligaments are good, functional, then they can be managed with CCK implants. And if the collaterals are non-functional, then we have to go to a rotating hinge knee. So very small, in short, the tips to decide the revision implants. First, do not cut more bone. The bones cut has to be very less. Joint line is very important, and it's femur which will decide the joint line. Use minimum constraint. 2-zone fixation is ideal. All the 3-zone fixation is best. Defect management will decide the longevity of the construct. Don't confuse constraint with anchorage, but constraint will always need an anchorage. So now what all companies offer? There are all the companies outside today which offer the joint replacements and the revision solutions. First of all, we talk what Merrill has us. In the CCK fragment, Merrill has got Freedom PCK revision system, which is also available in the opulent variety, the gold variety which they call. And in the hinge variety, the Merrill people have got Merrill fixed bearing hinge knee system. Again, a very beautiful system to manage the revisions. Striker, in CCK fragments, they have got Triathlon TS revision knee, rightly not available in India. They have got a very beautiful hinge which is called Triathlon MRH modular rotating hinge knee. When we go for Zimmer, in the CCK fragment, they have got Next Gen Legacy Constraint Condylar Knee, LCCK, a very old implant. And in the hinge also Zimmer, they have got Next Gen Rotating Hinge Knee. Biored people, in CCK, they have got EvoCon, which is a progressive constrained knee system. In the hinge, they have got Genius Rotacon, again a very beautiful system for managing the defects. Then Depu people in CCK, they have got PFC Sigma Revision MBT, that is a mobile bearing tibia tray, and a very well known TC3 Total Condylar Knee, which we all use. In the hinge, they don't have anything. Smith & Nephew, again, they have only got a CCK option, which is called Legion TKAs. The hinge variety, again, they don't have anything. TTK, they have got options for both CCK, which is called the Buccal Papa's revision knee system, And in the hinge knee, they have got Bupal Papa's hinge knee revision system. Link people, again, they don't have anything in CCK, but their endo model link is very beautiful implant for revision knee replacement. Metatech, they have got options in both CCK and hinge. CCK, today only they have launched the system, they call it Gen Z revision knee system. And for hinge variety, they have called Gen X hinge knee revision system. Just to end, a word on tumor prosthesis. We have at present 8 companies in India which gives us tumor prosthesis. 4 of them are the MNCs and 4 of our Indian companies. So for the foreign companies, Link, they have got the Megastem. Striker, they have got the GMRS. Debut, they have got the LPS, the limb preservation system. And Implant, Cast, an American company, recently they have launched the Mutants. Indian companies, they have got Edler, Excello and Metatech, and also SMPL, which gives us a very beautiful tumor prosthesis. These are relatively a bit cheaper. The previous ones are a bit costly implants. So, just a decision algorithm and take-home message. Constraint follows the ligaments. Reconstruction follows bone loss. Individualized planning is always necessary. Always avoid over-constraint and always follow all modern fixation principles.